Hi friends, Dr. April Kern here at Smiles at Reston Town Center. I'm going to walk you through a video of a dental implant. Don't worry, it's not too scary. Tiny little bit of blood, so if you're squeamish, I think you can get through this. Okay, and the surgeon is not me, by the way, it is my husband. This is a dental implant on one of my team members, and it's in placing one of her upper right hand back molars. Let's go ahead and watch. Okay, so this is actually in the patient's mouth, and what this drill here is doing is called a tissue punch. It's going to remove a little bit of the gum tissue, so there's room for the actual implant. So, and this is actually real time, so how fast the dental implant is performed. And of course, she's done beforehand. Okay, and this next part here is where just removing that little bit of tissue with the little curette, popping off that bit of the gums. Again, completely numb, not feeling a darn thing at this point, super fast. And then we are creating room for the implant in the bone. It's called an osteotomy. You know how I love my Latin, right? Osteotomy, osteotomy. Osteo is the bone, and otomy is a hole, so hole in the bone. So you use a series of different drills, and it's all in a kit, so you know like what size to place, because you can measure it all out beforehand. So you're making your osteotomy, and you're going a little bit deeper, a little bit wider there, just to make sure there's enough room for that dental implant to go into the jawbone. It's sequential. You go through step by step here. Again, this is super fast. This is all under 5 minutes. And then you finally get to the size that the implant is going to be. And then I had him stop and show us what actually carries the implant from the sterilized, like sealed pouch. And this is an implant driver, and that's what an implant looks like. This one is a Pal-Top implant. And then watch how slowly the implant is actually screwed into your jawbone, right? It's kind of like, it's almost slower than I imagine it would be, right? Compared to like other drills in dentistry. So it's slowly kind of cranking the implant in there. Again, you're not feeling anything at all. And then after it is completely in with the drill, then you go in and you kind of hand torque it and hand tighten it. And then you go in, you can actually use your fingers, make sure it's super tight. And then you just take an x-ray and see how beautiful that is. And that is a dental implant, people. So dental implants are not scary. They can be super fast. They can be guided or not guided. And depending on the situation, you may even be able to get a temporary tooth on top. Probably not in the back, you don't really need one here. But I hope you learned something by watching and it wasn't too gross and gory, right? Okay, thanks for watching.